are live here in Abu Dhabi at the Mohamed Bin Zayed City Field Hospital. I'm joined now by the Chief Medical Officer, Dr. Anwar Sallam. It's wonderful to have you join us this morning. Thanks so much for having us here.
Thank you so much for having me too.
This is one of 4 field hospitals that the UAE has set up in order to really prevent a fear factor in this country, because it's not necessarily the fact that you need to fill all these beds immediately. It's really about being prepared.
Very true. So the UAE has been monitoring closely the pandemic that's happening all over the world. And as a precautionary measure, we have elected to set up a number of field hospitals. There are 4 of them, the largest of them in Dubai with a bed capacity of 3,000. And this one is the newest addition with a bed capacity of 1,200. There's going to be around 200 healthcare providers between physicians, nurses, and allied health. There's going to be in-house pharmacy as well as a lab and an imaging department. We are going to offer portable chest x-rays as well as a mobile CT scan.
So thousands of square meters.
It is around 29,000 square meters.
So it's a massive tent city. We saw that driving in. I want to ask you about how quickly the UAE government moved to get involved in this space specifically.
So 3 weeks ago, this space was literally empty. And within 3 weeks, we managed to erect all the tents and all the rooms were up and running. And we managed to equip all the rooms with medical beds, and we provided all the medical equipment needed to run this hospital.
So this is just one part of a multi-pronged approach that the UAE is trying to take in terms of preventative care and in terms of taking care of those who've already been infected.
Yes. So our approach was very proactive from the beginning. We have introduced massive screening programs. As a matter of fact, the UAE ranked 3rd in the world in terms of testing per capita. We have adapted the drive-through methodologies and drive-through centers way before many countries. Currently, we have 14 drive-through centers, and right after Eid, we're going to add another 6 centers. The purpose of these centers is to maximize and ramp up our testing capacity to ensure that the majority of the public are going to be having easy access to those screening
What's
methods.
your biggest fear here? Because obviously the airlines are starting slowly to open up. We're talking about flights out of the UAE, but also repatriation flights for residents as well increasing. What's the biggest fear here for you as a medical professional? Is it that folks won't be monitored efficiently?
All right, so Hadley, we are lucky to have a government that has given us clear instructions and clear directives. They have created a very solid platform for
also
all these activities.
Walk me through that.
Yes.
Yeah.
We have an app that's called Al Hassan app. This app, we feel, as a country, is going to be more effective in terms of preventing the spread of the virus compared to a total lockdown.
Yeah.
We do understand life has to go back to normal. The UAE government have elected to go the gradual way and the guarded way at the same time. Not all malls are going to be open, but before opening all the malls, we made sure to screen all the mall staff. We are allowing only 30% of the people to go into the malls. We have restricted admission to those malls to elderly people and the very young people.
As a medical professional, and when you sit back and you see all of the different ways in which you can at least work to prevent more infections, different areas of the country have different rules. Dubai has very different restrictions at times than in Abu Dhabi, for example, with regards to malls and that kind of thing, and social distancing. How important is it, do you think, that you have a universal approach on this? And then how do you take that global?
This is actually very important. It helps streamline all the strategies and policies, and that's what has happened in the UAE from the beginning. We have created at a nationwide level National Infectious Disease Council. That Infectious Disease Council was responsible for publishing all the guidelines in the treatment of the COVID. At the same time, we were grouped together with our private providers, and we followed the same policies and procedures. We worked hands in hands trying to maximize the capacity of our existing hospitals, and as a precautionary measure, building up those field hospitals.
But doctor, when you have different regulations in Dubai, for example, versus Abu Dhabi, doesn't that make your job tougher? Doesn't the government need to have the same restrictions in place across the board?
To tell you the truth, Hadley, it's very difficult to have one approach and believe this approach is going to be correct. I feel that the whole world is on a learning curve, and whatever is happening in Dubai by far is being considered as per the local authority to be the most appropriate. I do understand they have taken other measures other than just opening the malls. They have already locked up areas, they've screened people. Screening is actually available, and by the grace of God, we were blessed by the latest initiative by Sheikh Mohammed, whereby he has instructed us to offer free testing for all UAE nationals, every person who's having symptoms and every person who's been in contact with a positive case, as well as elderly people above the age of 50, anyone who has a chronic disease.
So no one-size-fits-all approach anytime soon, in your opinion. So that's important, obviously, for the business sector in terms of what's going to happen next. So they're just going to have to continue to remain flexible.
Definitely, and as I said, we are ensuring the public that whatever happens from a healthcare perspective, we have made sure that we are ready for any emergency or any surge in the number of cases to come.
Well, as governments globally look to tackle the fallout from COVID-19 and get everybody back to business, here in the UAE, they're taking a multi-pronged approach, including building a 29,000 square meter facility right in the middle of the desert. We're going to take you inside right after this. Stick with us.
Hadley, just talk us through what's happening there.
That's right, Karen. We're here at the Mohamed Bin Zayed Field Hospital. This is one of 4 that's been created here in the UAE to tackle the fallout, frankly, from COVID-19. There are going to be 4,000 beds available once these field hospitals come online. There are 1,200 beds in this facility alone. Now, as you can see me, this is actually pretty luxe accommodations, isn't it? For what amounts to a tent city built in just over 3 weeks in the middle of the desert. Now, this is part of the multi-pronged approach that they're taking here in the UAE to tackle COVID-19, but also to get back to business as soon as possible. One of the things that we've been hearing from business leaders across this country is a lot of confusion and white noise, not just about safety, but about government regulations, because quite often you'll find that it's the case that in Dubai versus Abu Dhabi, there are different ideas and different regulations coming from the government, even overnight, that businesses and employers and employees are going to have to deal with. Part of that is being nimble, but also there is a lot of fear, frankly, amongst employers about how they're going to deal with this going forward and basically keep the lights on. The latest survey out of the Dubai Chamber of Commerce has essentially said that small and medium businesses are very, very much at risk here. 70% of them could go out of business in the next 6 months alone. So, of course, it's very, very important for the UAE government to get ahead of all of this. I asked the head of the chief medical officer of SEHA about it and said, how quickly can they get back to business? Listen in.